Hey everyone, Dr. Leigh here from Your Vet Online. It is the first of the month, and if you're here, you can ask me any question you want about your cats, dogs, horses, pocket pets. So just write them in the comment section and I will get onto it and answer them as they come through. So if you haven't met me before, make sure you say hi so I know who I'm talking to. And yeah, as I said, I see I've got someone else online at the moment. Yeah, we only do this once a month. So once a month, we let you ask any sort of question you like. And then the other weeks of the month, we go into more specific detail about a particular topic. So this month, we're going to have some chats, hopefully, about equine reproduction, because August is the birthday for a lot of horses out there, and we're heading into spring. And then, so July, we're going to try and do a few reproduction type chats. Once we hit August, it's dental month, so we'll head into doing some dental talks. So if you, and this is all with horses and cats and dogs and your pocket pets, so don't think it's just something that is, you know, we just stick with that one animal. So, and always make sure that if you have any questions, you just ask us. Hey Lindsay, right. Hi, please can you tell me, we have a horse that was blood tested for selenium levels and it is 3200. How much will it take on a minor selenium diet to drop back into within normal levels? Yeah, selenium can hang around for quite a long time, Lindsay, so I would probably not retest again. Give it a couple of months at least. Yeah, you don't want to go too quick because it's not going to happen quickly, because it's kind of like it gets into the whole system, and so yeah, it can take a while. So definitely just make sure that, yeah, don't go too fast with it, but just, yeah, definitely I would be a couple of months before I would test again, and just to see how it's going. Where are you based, Lindsay? Because that's quite interesting. I'm wondering if you're a Kiwi, because very few Australians, I think, test for selenium, and it's one of those elements that we do have a really low level in our pastures. So it's important, whether you're in Australia or whether you're in New Zealand, that you do actually give selenium. But then the other problem, as you notice, Lindsay, is that sometimes you can actually end up giving too much. And I think that comes down to people, and I'm not accusing you of anything, Lindsay, this is just a general comment, is that a lot of people end up feeding a bit of this, a bit of that. There's supplements all over the place, and you don't actually know how much you've actually got of each little thing. And so for horses, I really recommend a nutrition spreadsheet called Feed Excel. You can do your own at home. You put in all your diets and basically everything that you give. So whether you give, you know, a commercial diet, you put in all your supplements and everything, and then you'll be able to see what you're doing. But yeah, as far as your question goes, Lindsay, definitely leave it a couple of months before you start retesting again. Otherwise, you're just wasting a bit of money. All right. Hey Lorraine, hi Lee. One of my Dachshunds continually licks the other one's ears. Is there anything I can do to stop it? Probably not. With anything behavioral like that, I always say we've got to look at things like dissociative behavior, you know, trying to make them do something else when you see it happen. The biggest problem with this is when you're not around, of course. And so that makes it hard. But like anything else, like if you've got a dog that wants to eat poop off the ground, if you don't want it to happen, you pick poop up. With a dog's ears, you know, you can't do much if you're not around. However, if you're around, and if, you know, like with the poop on the ground is another type of example, is you might throw the ball, or you call them over to you and you do a little bit of, you make them sit, stay, you know, do some tricks, do something. You take their mind off it. So that's the whole aim when you've got an animal doing something you don't want them to do. Giving them flicking them, hitting them, water pistols, all of that sort of stuff is negative, and it's very much a punishment, and it doesn't really work. Sometimes they end up thinking and associating the wrong things. So you're much better off distracting, doing something else. So it works for a lot of things. Righty ho, let me see. Righty ho, Courtney. My cat keeps wanting to go out. She climbs through my windows. I'm on the top floor in a block of flats, and it's too hot in England currently, and plus she can't go out due to being in season and being an indoor cat. Okay, so, well, can you get a spade? Because honestly, you don't want a female cat to have mammary cancer, and if she's older and she's got, yeah, you might be a bit late there, because mammary cancer in cats is really bad news. So that's one of the reasons why I always want people to spay their cats, and also they're at risk of having a pyometra. And I've got a pyometra. Actually, I'll see if I can bring it up. Thing on my article on my website, and yeah, it might be a one to have a look at, but that's just an aside. But yes, and then the other thing you can do is, I'm not sure how your flats are doing this, but you could potentially ask if you can put fly screens up on your windows. You could possibly, if you do have a deck, you might be able to encase that with some sort of netting of some sort. A lot of people do that sort of thing. Yeah, I'm not really sure. Like my house where I'm living now, I've got fly screens, so potentially I could have a cat, because I can leave, you know, they're right across the door, they're right across the windows. It works really well. But yeah, it's difficult to know, especially if you're in one of those flats that got the wooden windows, the old-fashioned windows. Like I've lived in those sort of houses before, and it can be a bit hard to keep them in. But yeah, try that. That might work. Righty ho, Vanessa. Hey, I have a 10-year-old desexed male golden retriever. He became acutely lame in one of his back legs about a month ago. We took x-rays, which didn't show anything really apart from a bit of arthritis. He's had a course of cartrophin, 5 days of carprofen, and then we changed the method. Made a big difference. Okay, he's now on foresight. Well, this lameness is pretty still far from. Just wondering if there's anything more you can suggest we try. Okay, it seems to be up in his hip area. His leg was collapsing and sliding out from underneath him when he was trying to put weight on it. Now, but he's still. Oh, that doesn't sound too flash at all, Vanessa. I'm wondering where you are as well. Sometimes, guys, it's good to know where you are, because I can then recommend vets in your area. But Gundagai, Wagga Wagga, Hargraves. Anyway, so let me see. Okay, I'm wondering if they took x-rays. I'm hoping they took x-rays with him under anesthesia, and when you do that, you can then manipulate the leg and just rule out a whole heap of things like the stifle and everything like that. Now with the hip area, just like us, remember it's a ball and socket joint. So we've got our ball and we've got our socket, and it fits in neatly like that. Now, there could be still things going on in that joint that you cannot see from an x-ray. And it might be because, one, it was say maybe a very fine crack, and you've actually got an x-ray again at a later date. So you're saying it was about a month ago. Look, it'd be perfect now. I always sometimes, if I'm highly suspicious that there's something a little bit insidious, like a fracture, but it's not showing up the first time, I will often re-x-ray a particular leg or a joint body part about 10 to 14 days later. And what it does, because you've got to remember that bone has a high turnover, and when it fractures, you've gone from like a bone that's all neatly together to a bone that is apart, and there's what we call dieback, and we can see more on an x-ray later. So sometimes that could be an option. So you could potentially have them x-rayed again, and you may see something now because it's been 4 weeks. The other thing is that, going back to our ball and socket joint, remember we've got cartilage that is in that area, and that doesn't show up on an x-ray. Sometimes we have issues where we've got that, you know, some of that well, I'll call it fracture, but it's not really a fracture as such. It's more of a, what would you call it? Basically the cartilage gets damaged, and so in that area you could have the cartilage could be damaged, and you're not going to see that on x-ray. And the only way of seeing this sort of thing is if we go and do CT and MRI and all that sort of stuff. So up to you whether you want to go with that. The other thing is that sometimes you can actually get nerve damage, of course. Like maybe he ran into something and just gave himself a hell of a bang, and he's damaged his nerves in that leg. And nerve pain related to either a nerve that goes down the limb, or whether a nerve that's actually starting from the spine. So remember, you've got the lumbar vertebrae in that area, you've got your sacroiliac area. There's lots of nerves, and if there's any damage to any of those, you'll see changes. And if you're saying it's about a month now, one thing that you should be really looking for is asymmetry with the legs and the muscles, and just seeing if there's any particular area that's really wasting away as such. So it's very hard to give you a diagnosis just here now, or anything, you know, but I think potentially you can go back to your regular vet and have another chat, and you could potentially look at getting a either a veterinarian or a physio. And when I say a physio, I'm not talking just about an animal massager. I'm talking about a human or veterinarian that's done animal physio, and get them to look at the animal as well, your boy as well, because some of those it's a little bit, we're not just looking at giving them a bit of a rub, we're actually looking at trying to make a diagnosis, and you need somebody that understands the anatomy really well, and human physios that have then gone on, done further training in animals are really good like that. If you want to PM us, I can, and let us know where you are, I can put you onto some people if you want to take that route. All right, Erin, is it normal for a dog to go a few days without toileting after a bout of the runs? He's on a bland diet of rice and chicken to combat it at the moment, but hasn't gone to the toilet in about 48 hours. I had a bit of an issue myself a couple of weeks ago. And yeah, that's normal. Probably too much information there, far too much information. But yeah, you should be noticing, look, if you haven't stopped the diet, well, actually, I'm just thinking about myself, yeah, I didn't stop eating. Yeah, that can definitely happen, because basically you give yourself, well, the dog's given himself a good clean out, and even though you're feeding something nice and bland, it's probably not, yeah, going through much. The other thing to be careful of, though, I'm just looking at your thing, is sometimes when a dog or a cat is constipated, they sometimes have, they can have the constipation area, and then they can sometimes have the diarrhea and everything sort of go around the edges. So there could be something really hard and yucky in there. So I'd be looking at make sure he's happy, he's eating, he's running around, he's doing all the things that you want him to do, and just bide your time. If he's depressed, vomiting, straining, not wanting to eat, sleeping a lot, time to go to the vet. So yeah, because 48 hours, I reckon he'll be pooping either tonight or tomorrow. Hopefully, if nothing's wrong. Okay, Dr. Leigh, my cat has broken one of her canine teeth. Ouch! It doesn't seem to be bothering her, except it's causing a slight abrasion on the top of her lip. Is she likely to need a tooth removed? Yeah, likely. Look, it's I would head off to the vet and get that looked at, because we've got to remember that for some reason, animals, I think it's because they're sort of a prey species, they don't tend to show pain as much, especially with their mouth for some reason. Like, they can have really bad tooth decay. Actually, we see so many animals with such bad teeth, yet they don't seem in pain. And unlike us, who we're stuck in bed, we're dying, for some reason cats and dogs don't, and horses for that matter, don't tend to have that issue. So I would always get an animal's tooth checked, because then you can make sure the vet will know whether it's actually got any pulp that is exposed. We know if there's any risk of infection going up the tooth from outside, and it may be that we need to remove that. So better to be safe than sorry. Your vet will be able to tell you when they have a look, and they can check her other teeth out. And it's always good to have a dental once a year at least. So even to get all the teeth just looked at, get everything x-rayed, make sure everything's clean, and if she needs it removed, she can have it removed. It's always a good idea. Right. Shoshi, we have an elderly 12-year-old greyhound. Would glucosamine and or chondroitin be advisable, and if so, what dose? He's approximately 30 kgs. I hate glucosamine and chondroitin. Sorry, peeps. There is no evidence that the stuff works. So I just don't. Look, you are far better off getting a product such as green lip mussel that works. Like any of the green lip mussel products, they're very good. I just cannot like, I've just never seen any good evidence to say that glucosamine and chondroitin is any good for our pets. And to be honest, even humans, even though we won't go there, but it's one of those are some of those products which for some reason became all the fad, and people just keep using them, and without evidence that it actually worked. So if you know me at all, you will know that I'm all about evidence-based medicine. So yeah, I would just be, I wouldn't give it to my own animal, put it that way. Like, yeah, I'm all about using products which have got some efficacy and studies that prove that they actually work. If you find a study that you think says that it works, feel free to send it to me. I'm always happy to be proven wrong. But yeah, at this stage, I wouldn't bother. He's recovering from a back injury and he's on cage rest for over 2 months. Okay, so as far as a back spinal issue, it really depends what sort of issue was there, because the products like all those sort of products probably aren't going to do not going to help heaps for like spinal stuff. They're usually for more mobile joints. But yeah, you could try something, and I like the green lip mussel based products. So look at those, and and we'll see. Amanda, hello. Have you seen dogs recover fully from FCE? Now, we had a few of those when I've worked in emergency centres, and unfortunately when you work in an emergency centre, you often don't actually get to see the pets later, you know. So like we might do the emergency part, we do the surgeries, and we don't get to see follow-up. So to be honest with you, myself, I haven't really seen any recover, from long term. That I've seen them, you know, be okay for a little bit, but yeah, but definitely don't take that as gospel. Yeah, if you want to PM us, I can have a quick look-see, and I'll see if I can find some stats on prognosis. I'd have to look it up. I can't remember that at this moment. But yeah, I myself haven't had too much experience with that. I've definitely seen cases with it, and it's pretty horrific. So I hope you haven't got one that's got that, Amanda. Right, who have we got here? Belinda. My King Charles is on vetmedin. How do I know she's on the correct dosage? She's 8 years and weighs 9.8 kgs. Okay, I'm assuming, Belinda, that your King Charles is on it because they have a heart issue, and it's hard to know from that sort of from what you've written there exactly what might be the issue. Often we use vetmedin for people that don't know what it is. It's a drug that helps contractility and pushes the blood flow through and helps in those animals that might have a mitral valve issue. So these are animals that have, so in our heart we have valves, and the mitral valve might get a little bit floppy, and we get a problem with fluid that just blood that just keeps going through, and there's no stoppage. So with the valve, you normally have it open and it closes like so. And in this case, because we don't do a valve transplant, well, you can, but we don't do valve transplants. We want to help it so that we don't, so we are able to have a decent amount of pressure so that the blood can be pushed out into the other parts of the body. So anyway, as far as the correct dosage, I can't tell you that from just what you've written there. There's a whole heap of questions I'd need to ask you. We can definitely do that via a consult. You could ring. I'm not sure why you're asking that. Is your dog having problems breathing? Is their respiratory rate really high? I want people to remember that if their dogs have ever been diagnosed with a heart issue like mitral insufficiency, people might vets might call it congestive heart failure, that if their respiratory rate gets above 30, then really you need to be going back to your veterinarian and getting medications looked at, because things might not be appropriate. Now, it's not a rush. You need to go in immediately if you measure their respiratory rate and it's above 30, but in that next week, you know, like organize your shit so that you get to the vet, basically, is all I'm saying. So the way to test a respiratory rate of your pet is you wait till they're asleep. So that's really important. Don't do this when they're awake, because any sort of little bit of excitement, yeah. Oh, and don't do it when they're having those dreams where they just are running after rabbits and squealing and stuff, because they're a little bit excited then. So you want them to be really nice and relaxed, preferably asleep, or just, they can be awake, but you know, they're very calm. And then look at a clock or a watch, and you want to count for 15 seconds, count how many breaths they have in 15 seconds, and then times that by 4, and that's how many breaths they're having per minute. And if that's over 30, then you need to go and see your veterinarian and get the medication sorted. Hey, Yanli, how are you? Hope your puss is doing well. And Andy, hello. Right, Tennille. Hi, Dr. Leigh. Hubby's thoroughbred mare had torn some of her heel and hoof off in the paddock. On some rocks, we had some pink flesh showing where the hoof wall is missing. We wrapped and booted her. What would be some ways to promote hoof growth? Okay, just doing what you're doing. Like, honestly, keeping it clean, keeping it, yeah, I'm just thinking if torn her heel and hoof off. So it sounds like it's at the back. So the heel bulbs, that's quite a common injury. They actually do heal up pretty well. Yeah, keeping it clean, keeping it wrapped up is the best way. I do like shoeing some of these horses because you've got to always remember that when every time they put their foot on the ground on a hard surface, so so they're punching down on the hard surface, their foot spreads, and it's that movement, and that can actually inhibit growth. So a lot of those horses, and look, I don't have a picture, I can't tell you from just looking at this, but if you want a consult, we can do an online consult. If you give me pictures and a video, we can have a look. Depending on how bad it is, sometimes with these, I actually recommend they get casted. So you actually put the hoof in a cast, and you might have it on there, and sometimes it's just long enough, it could be a few weeks, just to promote, like, keep that really stable so there's no movement, because it's all that movement that causes issues, and as you say, it can take a while to heal. Yeah, so, and then the other thing is you can do that with shoes, some types of shoes as well. You do need a good farrier that knows what they're doing, because there's certain types of clips and types of shoes that we can use. But if you want to, you can head over to yourvetonline.com, have some photos, or we can do a video and go through exactly what it looks like, and we can give you some recommendations of what you need to do if that's an option for you. Bloody hoo! Hey, Dr. Phil. Right, Vanessa, thanks, that's great. Ah, yes, yep, Vanessa, that sounds like a good steps, definitely. No worries, Ray. Thank you for anything. Right, hit the runs for a few days. Eating seems to be excellent. Hey, Timo, how are you? I hope Tina's good. 40 kg. Oh God. Oh, Timo, you're going to get a cockatiel. I love cockatiels, people. And yeah, the best place to get one. I want to have. Oh, yes, we do want one that's really good. I'm not sure, actually, to be honest. Leave it with me. Can you PM me so I don't forget? Because yeah, well, if anyone else might have suggestions, they can put a comment down there below. I must say I love cockatiels, and yeah, there used to be this this page on Facebook that with all the cockatiels, people would just take pictures of their cockatiels doing stuff. Oh my gosh, it's so good, so good. I'll have to find it again. Yeah, I wonder if it's still there. Anyways, yeah, it was really cool. Anyways, Timo, I will see what I can do. I might even have fellow veterinarians that breed cockatiels. Who knows? You know, we'll find out. Hey Lou, I'm a groomer and I have quite a few obese dogs on my book. What can I say to help owners understand it's not okay? Do you know what, Lou? I was actually thinking of doing an obesity talk next week, so I think I might do that. Yeah, hey look, it's hard. It's really, really, really hard. A lot of the time the owners have a weight problem too, so it's like one for me, one for the animal. Yeah, what I always suggest is, and I mean this is hard for you because as a groomer, but you could always talk about looking at how many calories are in the food they're feeding. You can look at how many, and then we can, what I'll do is I'll try and get the calculation and everything for you for the talk next week, and so make sure you tune in, and then you can do a little quick calculation of how much the animal needs. And sometimes you can actually change the diet. Like, there are some diets out there that are just really, really, really high in, well, they're actually pretty shit diets, to be honest. Like, they're high in fat. Don't be fooled with this, all this has to be low grain, no carb thing. That's not an issue. It's more about how much of each thing, each ingredient is actually in there. So anyway, yeah, so tune in next week, Lou. I'm going to, maybe you could tell all your clients, send them a little note and say, watch this. But yeah, it is a massive problem. Look, humans have got the same problem. We're a society of overweight people, and yeah, it's very easy to eat more than you should. So other quick little tips, you can give carrot and zucchini, cucumber. Cucumber's really good. Cats love cucumber. If you've got cat clients, just not cucumbers that are on the ground. If anyone's watched those videos, or zucchinis, yeah, disaster. Cats don't like those on the ground, or a banana. Anyway, I digress. Yeah, so I like to increase the fiber, so they might have some carrot and broccoli and zucchini in their food, and it fills it up, so the dogs or cats feel like they're having a big nice meal, and yet they're not getting all those calories. You know, it's like having empty calories. Just like us, they should eat more of that sort of stuff so that they lose some weight. Anyways, right, Harriet, hello, can you recommend a good greenlit muscle supplement? Yeah, there's a few on there. Are we talking horses or are we talking cats and dogs? Products like your Foresight, your Sasha's Blend, all that sort of thing, they seem to work okay. I did a lot of the studies with BioLane. Yeah, there's a published one. This is with horses in the Equine Vet Journal. That's an amazing product. Just love, 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 love that product. Don't think that's in Australia, unfortunately. But if you're a Kiwi, try and find that. Yeah, amazing. Okay, best thing to control scours in an orphan lamb. Carly's asking this one. Got to know what you're treating first, Carly. So best idea for this is you need to get a little sample of poop, take it down to your vet and just find out and make sure it's nothing contagious, so it doesn't have something like rotavirus or coccidia or anything like that. Once you've ruled out, or well, you can do this at the same time, but you look at what is in the scour, you know, the scours, make sure that it's nothing contagious. But also, if it's an orphaned lamb, I'm assuming that you're feeding milk powder. I hope you're feeding one designed for lambs, because that's awfully important. You've got to make sure you're doing that. And then make sure that you're not overfeeding, because sometimes if you're giving far too much milk, you can actually end up causing them problems too, and it makes them scour. And then also, at the moment, you just got to make sure that you don't mix your electrolytes with your milk powder. Okay, so some people might tell you to do that, but you're not to do that. You feed a milk drink, and then you'll feed a separate one later. A few hours later, you feed your what do you call it, your electrolyte mix. That's if they're quite flat and yeah, not doing that well. So yeah, you definitely need to actually get a diagnosis first, because yeah, you can make sure you're feeding correctly as well, but you need a diagnosis because it might not be a nutritional problem. It may well be actually that you've got a some sort of virus, you know, rotavirus. You may have coccidia, all those types of things, and then you're going to need treatment. So best bet for you would be to get a little poop sample, pop it down to your local clinic, get them to test it, and then go from there, and they'll let you know whether you need any medications to go with that. Okie dokie. Hey Kerry, hey Suj, how are you? Righty-ho. Erin, you're looking at a dog with mild luxating patella. Most vets jump on surgery straight away. He's a Chihuahua. Look, supplementation is not going to do a thing for that. The reason why vets are saying surgery is because he probably needs either surgery or he needs to build up the quadricep muscles in his leg. So if surgery is not something that you want to do and it's a mild case, then I would be looking at seeking the help of either a veterinary physio or a human physio that does animals, and get his legs working better so that he's actually building up those muscles in his legs. Now, if he has got a stifle joint, because remember we're talking about a knee here, if his joint, if he's got no, like there's actually grooves, and then the patella sits within the groove and holds it in place. And so these have actually got to be a little bit high, you know, they've got to be up a little bit so the patella can sit in. If they are too flat like this, then the patella just flops over. So the vet can definitely get an idea of that when they examine your dog. Often we do have to anesthetize or sedate them so that we can do this properly. If they're said to you, look, he definitely needs surgery because he's got no grooves, yeah, you're pretty much buggered. And don't forget, oh, he's had it for 6 years without getting worse. Oh, okay, well, yeah, he's going to have arthritis now. My next comment was going to be, you want to look at doing these things early to prevent arthritis. So as far as a supplement, you're not going to help a luxating patella with a supplement. The aim of having a supplement is actually helping keep control of any arthritis. Now, remember that the arthritis is caused by the fact that patella is moving so much into the wrong place all the time. So it's going to be hard. Like, it's hard for us up. Yeah, it's not easy. I wouldn't. You can try things like your Pentazan, your Synovin injections. You could try using a supplement such as, you know, a green lip muscle supplement. Yeah, when you actually have an anatomical problem, giving supplements is not, you might not see too much improvement in that. Hey Moby, how are you, Mr. Moby? Right, Sonia, my dog is almost 17, kettle cross stiff, vet gave medication for arthritis, back legs. This helps, and she makes a noise when she rubs her nose on her legs in grass, and also head up like she's trying to get something from her throat. Not sure she needs to be put to sleep. Oh no. Okay. I'm not sure exactly what you're meaning there. Look, if you're worried about her, Sonia, it may well, I think it is wise to get her looked at. We can do that on an online check to consult where we video, and we can have a good chat and talk about exactly what's going on with her. If you want to do that, our website is yourvetonline.com, or you can go back to your regular vet and just see exactly what's going on there. Sometimes some of the medications, just like with people, don't suit our pet, and so it might be a situation where they may have to change the medication, which isn't necessarily a bad thing. It just means it's taking a little while to find the right one that suits the animal. Just like sometimes with us, it can take a while to find medications to suit us. So look, you might be at a stage now where you might decide that it's time for her to be euthanized, but it also could be just a tweaking of whatever you're giving her to actually improve how she feels. It just might be the wrong medication or anything like that. So hopefully that answers your question there. All right then, guys, doesn't look like there's any more questions. I've been going for about 45 minutes now anyway. Thank you so much. If anyone's got any quick ones, I can see there's a few people here. Quickly, just write something. Otherwise, yeah, I will catch you all next week. As I said earlier to Lou, I'm looking at doing a talk on obesity and feeding our dogs and trying to keep the weight off, because like me, I'm on a diet now myself. Because yeah, things sometimes can be get away on us. Yeah, so join me next week. Yeah, we'll be on 7:30 p.m. Australian Eastern Standard Time. If you want to check out our website and sign up to our newsletter, we do a weekly newsletter that sends out all the links to the newest articles that I've written. And yeah, and our website is yourvetonline.com. All right then, hope you guys have a fabulous week. Make sure you tune in next week for the obesity lecture, tutorial, whatever you like to call it. And oh, Reese, you've just joined at the end. Dr. Erskine's a doctor though, so he knows it all regardless. He has no questions. All right then, guys. Thanks heaps for listening. Hope you have a fabulous week, and we'll talk to you next week. Join in for obesity talks, and yeah, check us out on yourvetonline.com. All right, catch you guys. Bye.